Welcome back. In New York City, overdose deaths increased in the first 9 months of 2020, with the most deaths occurring here in the Bronx. Opioids and fentanyl are involved in a majority of those overdose deaths, many of which are preventable with naloxone. Joining us now to share why overdoses surged in 2020, how to recognize and treat signs of overdose, as well as the best available treatments for opioid use disorder right now, is Dr. Kristine Torres-Lockhart, MD at Montefiore Health System and Assistant Professor of Medicine at Albert Einstein College of Medicine. Welcome, Doctor. Thank you so much for joining us today.
Thank you so much for having me. Glad to be here.
Of course, glad to have you. So we have this terrifying, sad news of what's going on in our community with opioid overdoses. Doctor, can you talk about this overdose surge last year and how and why did this happen?
Sure. Yeah. So nationally, throughout the United States, we're seeing huge surges in opioid-related overdoses. And this is something that New York State is not immune to. And so, like you've mentioned previously, New York City has seen the highest number of opioid-related overdoses in 2020 than we have ever seen in any preceding year of the opioid crisis. And so, like you mentioned as well, the Bronx in particular has been particularly hard hit by the opioid crisis. And when you sort of compare us with all of the other 5 boroughs of New York City, we have the actually highest number of overdoses. And again, this is the highest number we've seen throughout the crisis. So why exactly is this happening? I think it's really due to a number of different factors that have sort of culminated in this perfect storm, and many of them are related to the COVID-19 pandemic. So I think first and foremost, we're seeing increasing rates of isolation. So patients who previously might have been using with other people now are using alone due to, quarantining, social distancing, lockdowns, etc. And so we know that people that use substances alone, no one's there to sort of monitor them, and they're at increased risk of overdose. We're also seeing sort of changes in the drug supply as well related to the pandemic. So people may be using different supplies or different suppliers that they previously had not been and aren't totally sure what's in them, many of which have been adulterated with fentanyl, which we can chat about more too, but is a very powerful opioid that's like 50 times more potent than heroin and also contributing to a huge number of our overdoses. And then, of course, the pandemic has just contributed to a ton of anxiety and stressors for people everywhere. And many people cope by using substances. So we're seeing people using more substances just to cope. And then, of course, just lack of access to treatment. So whether that be mental health treatment, so they're not able to access treatment for their anxiety, depression, etc., with all the stressors of the pandemic. And so they're left to use other things. And then, of course, access to treatment for opioid use disorder itself. So with many clinic closing, also having limited availability to take new patients, patients just aren't able to access life-saving medications like they used to. And so I think all of these things together have made it a really troubling time for us to see all of these overdose deaths.
Wow, so many different contributors to the overdose crisis here in our borough. Thank you for sharing, Doctor. So you did mention fentanyl. Can you help us break down what that is, and also learn about which other types of opioids cause the cause in surges of death in our borough as well?
Yeah. So when we actually look at the New York City Department of Health data, when we look at what substances are involved in overdoses, we see that by and large, more than one substance is usually involved. So we can't always say this was the one thing. By and large, most people have multiple substances in their system in the setting of an overdose, whether or not they were intending that. But when we look at the whole culmination, over 50% involve fentanyl. So like I sort of mentioned a little bit before, fentanyl is an opioid. It's a synthetic opioid, which means it's man-made. It's usually produced overseas and illegally brought into this country, and essentially adulterates almost every single drug supply we have, at least in New York City. So it's 50 times more potent than heroin and incredibly cheap. So it's very easy for it to get into the supply to make a drug seem more potent as well. And so, but it's really hard for people to know exactly how much fentanyl is in the supply. So can be using things that they don't know are incredibly potent. Increasingly, we're also seeing other opioids in overdose-related deaths. So heroin is the second most common opioid found in overdose-related deaths. But we're also seeing other substances that are not opioids, but other sedating medications that sort of put people at risk of respiratory depression or sort of stopping breathing. And those are things like alcohol, and then also benzodiazepines, which also go by things like Xanax, Valium, Klonopin, things like that. And then the most alarming thing is that, we're also seeing fentanyl in things that aren't even depressants. So they're things that are in supplies like stimulants as well. So maybe people who are using cocaine or amphetamines and aren't used to using opioids at all, there can be fentanyl in those supplies too, and put people, of course, at much increased risk of overdose because they're not even tolerant to any sort of opioids previously.
Doctor, and there's no other way to determine if these substances have fentanyl in them until someone intakes them, right?
So there actually are some things that are distributed through the Department of Health, and we also do this at Montefiore in some of our hospitals and in our clinics. They're called fentanyl test strips, actually. And so we distribute these directly to patients, and these are often distributed in syringe exchange programs as well as a harm reduction tool. And so patients can actually test their own supplies in real time and see if fentanyl is in them. And then if it is, they can either choose not to use that substance or use it in a more safe way. So use it in the presence of other people, use a smaller test dose, or use it in the presence of naloxone or Narcan being nearby with other people.
Got it. We'll definitely talk more about naloxone and Narcan a little later on. But I wanted to ask, doctor, could these deaths have been prevented? If so, how?
So something I feel really, really strongly about is every single opioid overdose could be prevented and is a preventable death, which makes it the biggest tragedy of all. I think first and foremost, just having access to naloxone or Narcan is the number one way we can prevent overdoses. Oftentimes we distribute this and make sure patients who are on opioids or have opioid use disorder have it. But also if you or anyone you know knows someone or lives with someone who has opioid use disorder or uses opioids should certainly have it. Anyone who's using stimulants, like I mentioned before, for the reason I talked about, there can be fentanyl in those supplies without even knowing should have access to naloxone or Narcan. And then also, I just believe it's something that should be in the hands of every community member, just given that we are in the midst of an opioid crisis. And so folks can actually get naloxone or Narcan really easily in the state of New York State. So they can either get it prescribed by one of their providers, but you actually don't need a prescription. You can essentially go into any pharmacy, and there's this thing called a standing prescription. So any adult in New York State can actually go into any pharmacy and get naloxone from a pharmacy as well, with some training on how to use it, and just have it at all times, just in case you ever see any other community member who's overdosed and can save a life. So I think access to naloxone is the biggest thing we can do to prevent overdoses, but also just making sure that people who use opioids and have opioid use disorder have access to the life-saving medications that we know are incredibly, incredibly efficacious at treating opioid use disorder, decreasing opioid use, and literally saving lives and preventing opioid related overdoses. So the main ones are really methadone and buprenorphine, also known as Suboxone. And then lastly, this is something that's done in other countries and not in the United States yet, but is this idea of a supervised consumption site. And so these are actually places that are staffed by professionals who are very savvy in how to respond to opioid overdoses. And they have provide access to sterile supplies for people who are using substances and opioids. And people can actually use opioids or whatever drugs safely in that vicinity, be monitored. And if they do experience an overdose, they're able to respond in real time. And so these are things that are seen in other countries like Canada and in Europe, and no one has ever died in the setting of one of these things. And they also often provide supportive services, linkage to drug treatment programs, et cetera, and can be really helpful for people's health. And so I think that's something that we need here.
Absolutely. Thank you for sharing, doctor. And you did share some great treatment options and, these important treatments that are available via Montefiore and many other organizations in the Bronx as well. But how can we recognize that we need to assist someone who's having an overdose? What are some of those signs and telltale signs that we should be watching out for?
Sure. So first and foremost, someone is not responsive. And so they are not responding to voice, or maybe they're not responding to touch when you're trying to arouse them and wake them up. And something we also sort of think about and we train people doing is something called a sternal rub. So it's essentially taking your knuckles and rubbing on the sternum. It can be very uncomfortable. So if that doesn't wake someone up, we consider them unarousable. Also, you might notice that maybe they're not breathing, or that they're breathing very, very slowly. Maybe they even have like a tinge of gray or blueness to their skin just due to lack of oxygen, or maybe they're having some strange breathing sounds like gurgling. Those would all be indications that someone might have overdosed. And the first thing that you always want to do is call 911 and let them know that someone you think has potentially overdosed. And then, of course, if you were to have naloxone on you, you could administer it at that time. It's an intranasal spray that you just sort of insert into the nares and spray once, and that delivers the medication as well and can reverse an overdose within minutes. But again, you want to make sure you call 911 because that medication can wear off after about half an hour, and folks can still re-overdose with some of the medications that are still in their body.
Got it. And I definitely wanted to emphasize to our viewers that anyone can administer naloxone. You don't have to be, an expert or anything. Of course, you will receive training once you pick up the naloxone and Narcan kits, but you can carry with that whoever you are to help someone who is having an overdose. Doctor, without further ado, how can people access this treatment, whether it be naloxone, buprenorphine treatment, and methadone treatments through Montefiore here in the Bronx? If you can share any resources or contact information.
Sure. So Montefiore has a really long history of treating opioid-related harms across the Bronx. And so we have 5 different methadone clinics that serve over 3,000 patients in the Bronx with methadone for the treatment of opioid use disorder. And so please call the number listed on your screen if you want to be linked to care. Also, you can always just search online Montefiore opioid use treatment programs and be linked to one of those programs either same day or next day for really close follow-up. Additionally, if someone's interested in buprenorphine or Suboxone, again, another one of the approved and efficacious treatments, you can go to this website, montefiore.org/buprenorphine, or call the number below. And again, you can be linked with a primary care provider who can prescribe buprenorphine in a primary care setting, again, at one of our 7 sites across the Bronx and East Harlem. And then all of our clinics and our hospitals actually as well also provide naloxone distribution to our community members as well. And again, on some of those websites, you can actually link up with one of our community health workers who will be able to do the training as well for community members and give out some of these naloxone overdose prevention kits too.
Thank you so much for this wealth of knowledge, Dr. Torres-Lockhart, and thank you for joining us and sharing more about this rise in our community.
Of course. Thank you so much for having me.
Thank you. We'll be right back here on Open BXRX Tuesday.